first test that I'll be doing is Spurling's test, also known as Foraminal compression test. The purpose of this test is that it's performed on a patient when they come in with complaint of nerve root symptoms, but the symptoms are not, they're absent at the time of examination. So when the patient comes in, they don't feel those symptoms anymore. So the test is designed to provoke those symptoms and to make the symptoms happen there so you can see them. It is especially useful if the patient has complained of radicular symptoms on neck movement, especially in side flexion. So this test is performed with the patient seated and the examiner stands slightly behind. So normally I'd be maybe on her side, but I'm behind her now. The patient bends or side flexes the head to the unaffected side first and then to the affected side. The examiner places both hands on the top of the patient's head, and the examiner carefully presses down on the patient's head. The therapist would note any symptoms or signs that then occur at that time. A positive test result would be if the patient feels pain radiating down the arm / in the dermatome of the nerve root. And that is to the side that it is being compressed. So if her head is tilted this way and I push down, she would feel pain down this arm if it was a positive test. But note that neck pain with no radiation does not indicate a positive sign. So if I push down on her head and it hurts in her neck, that's not positive. It has to go down the arm. And this indicates pressure on a nerve root, so something's being compressed.